Are you aware that by the age of 50, approximately half of all men notice significant changes in their sexual function? And this number increases to 70% by the time they reach 70? But here's the good news. There's a lot you can do to maintain a satisfying sex life as you age. Welcome to our video on men's sexual health and aging. Today, we're going to explore a topic that many find difficult to discuss, but is crucial for maintaining quality of life as we grow older. As a medical professional with years of experience in this field, I'm here to guide you through the natural changes that occur in men's sexual health as they age and provide you with practical advice on how to adapt and thrive. Let's start by acknowledging that changes in sexual function are a normal part of the aging process. It's important to understand that these changes don't signal the end of your sex life, but rather an opportunity to explore new aspects of intimacy and pleasure. Throughout this video, we'll discuss 10 key areas of male sexual health that are affected by aging, explain why these changes occur, and offer practical tips to help you navigate this new phase of life. Our first topic is one that many men find concerning: changes in erections. As we age, it's common to experience differences in how quickly we become aroused, how firm our erections are, and how long they last. These changes are primarily due to a decrease in blood flow to the penis and a reduction in the production of nitric oxide, a crucial molecule for achieving and maintaining erections. The good news is that there are several ways to improve erectile function naturally. Regular cardiovascular exercise is one of the most effective methods. It improves blood flow throughout the body, including to the penis. Aim for at least 30 minutes of moderate exercise, such as brisk walking, 5 days a week. This not only benefits your sexual health, but also reduces the risk of heart disease and other conditions that can impact erectile function. Another important factor is diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can significantly improve your overall health and, by extension, your sexual function. Foods high in flavonoids, such as berries, citrus fruits, and dark chocolate, have been shown to reduce the risk of erectile dysfunction. Additionally, foods rich in L-arginine, such as nuts, fish, and poultry, can help boost nitric oxide production in the body. Stress management is also crucial for maintaining good erectile function. Chronic stress can lead to elevated cortisol levels, which can interfere with sexual performance. Practice relaxation techniques like deep breathing, meditation, or yoga to help reduce stress and improve your overall well-being. It's also worth noting that certain medications can affect erectile function. If you're experiencing difficulties, it's important to consult with your healthcare provider. They can review your medications and potentially adjust your treatment. Plan to minimize any negative effects on your sexual health. Moving on to our second topic: changes in the size and appearance of the penis. Many men are surprised to learn that the penis can undergo visible changes as they age. You might notice that your penis appears smaller or that the skin has lost some of its elasticity. These changes are primarily due to a decrease in blood flow and the natural aging of skin and tissue. One of the main factors contributing to these changes is the development of penile fibrosis. This condition involves the buildup of collagen in the erectile tissue, which can lead to a reduction in penis size and flexibility. While some degree of fibrosis is normal with aging, certain lifestyle factors can accelerate this process. To help maintain penile health and potentially slow these changes, there are several steps you can take. First, maintain a healthy weight. Excess body fat, especially around the abdomen, can make the penis appear smaller. Losing weight if you're overweight can help reveal more of the shaft of the penis. Regular pelvic floor exercises, also known as Kegel exercises, can help improve blood flow to the pelvic area and may help maintain penile health. To do these exercises, simply contract the muscles you would use to stop urination midstream. Hold for a few seconds, then release. Aim to do several sets of these exercises throughout the day. Staying sexually active is another important factor in maintaining penile health. Regular sexual activity, whether with a partner or through masturbation, helps maintain blood flow to the penis and can help preserve its size and function. It's also crucial to protect your penis from injury. This includes being careful during sexual activity and wearing appropriate protective gear during sports. Injuries can lead to scar tissue formation, which can affect the size and shape of the penis. Lastly, if you smoke, quitting can have significant benefits for your penile health. Smoking damages blood vessels throughout the body, including those in the penis, which can accelerate the aging process and contribute to erectile dysfunction. Remember, while these changes are a normal part of aging, they don't have to significantly impact your quality of life or your relationships. By taking proactive steps to maintain your overall health and addressing any concerns with your healthcare provider, you can continue to enjoy a fulfilling sex life well into your later years. In our next section, we'll discuss changes in libido and how to maintain a healthy sex drive as you age. We'll explore the role of hormones, lifestyle factors, and psychological aspects that influence sexual desire. Stay tuned for more valuable insights and practical advice on navigating the changes in your sexual health as you age. Now, let's delve into our third topic: changes in libido. It's common for men to experience a gradual decrease in sexual desire as they age. This reduction in libido can be attributed to various factors, including hormonal changes, particularly a decline in testosterone levels. Testosterone plays a crucial role in male sexual function, influencing not only libido, but also erectile function and sperm production. As men age, testosterone levels naturally decrease, typically by about 1% per year after the age of 30. This gradual decline can lead to a reduced interest in sex and potentially contribute to erectile difficulties. However, it's important to note that a decrease in libido isn't solely due to hormonal changes. Other factors such as stress, relationship issues, certain medications, and overall health can significantly impact sexual desire. Depression, anxiety, and other mental health concerns can also play a role in diminishing libido. The good news is that there are several strategies you can employ to maintain a healthy sex drive as you age. First and foremost, maintaining a healthy lifestyle is crucial. Regular exercise, a balanced diet, and adequate sleep can all contribute to better overall health, and by extension, a healthier libido. Specific dietary changes can also help boost your libido naturally. Foods rich in zinc, such as oysters, pumpkin seeds, and beef can support healthy testosterone levels. Omega-3 fatty acids, found in fish like salmon and mackerel, can improve cardiovascular health and blood flow, which are essential for sexual function. Some men find that certain natural supplements can help boost their libido. For instance, maca root, a plant native to Peru, has been traditionally used to enhance sexual desire. Ginseng is another herb that has shown promise in improving sexual function. However, it's crucial to consult with your healthcare provider before starting any new supplement regimen, as these can interact with medications or have side effects. Stress management is another key factor in maintaining a healthy libido. Chronic stress can lead to elevated cortisol levels, which can interfere with testosterone production and sexual desire. Incorporating stress reduction techniques such as meditation, yoga, or regular exercise into your routine can help mitigate these effects. Maintaining intimacy and emotional connection with your partner is also vital for sustaining sexual desire. This doesn't always have to involve sexual activity. Simple acts of physical affection like holding hands, hugging, or cuddling can help maintain intimacy and potentially boost libido. If you're experiencing a significant and persistent decrease in libido that's affecting your quality of life, it's important to consult with your healthcare provider. They can help determine if there are underlying health issues contributing to the problem and discuss potential treatments, which may include hormone therapy in some cases. Moving on to our fourth topic, changes in sensitivity. As men age, they may notice a decrease in penile sensitivity. This can be due to various factors, including reduced blood flow, nerve changes, and hormonal shifts. While this might seem concerning, It's a normal part of aging and doesn't necessarily mean a decrease in sexual pleasure. In fact, some men find that decreased sensitivity can be beneficial, as it may help them last longer during sexual activity. However, if the loss of sensitivity is significant enough to interfere with sexual pleasure or function, there are steps you can take to address it. One effective strategy is to explore new erogenous zones. As we age, our bodies change, and areas that were once highly sensitive may become less so, while other areas may become more sensitive. Take time to explore your body and your partner's body to discover new sources of pleasure. This exploration can not only help compensate for changes in penile sensitivity, but can also add excitement and novelty to your sexual experiences. Experimenting with different types of stimulation can also be helpful. For instance, using different textures, temperatures, or pressures during sexual activity or masturbation can provide new and potentially more intense sensations. Sex toys, designed for men, such as vibrating sleeves or prostate massagers, can also offer novel forms of stimulation. Tantric practices, which focus on mindfulness and the connection between partners, can also enhance sexual experiences. These practices often involve slow, deliberate touch and can help you become more attuned to subtle sensations. Even if you're not interested in fully embracing tantric sex, incorporating some of its principles, such as focused breathing and mindful touch, can enhance sensitivity and overall sexual pleasure. Maintaining good overall health is also crucial for preserving sensitivity. Conditions like diabetes or circulation problems can affect nerve function and sensitivity. Managing these conditions through proper medical care, diet, and exercise can help maintain sexual function and sensitivity. It's also worth noting that certain medications can affect sexual sensitivity. If you've noticed a significant change in sensitivity and are taking medications, particularly those for blood pressure or depression, consult with your healthcare provider. They may be able to adjust your medication or suggest alternatives that have less impact on sexual function. Remember, changes in sensitivity don't have to mean the end of sexual pleasure. By being open to exploration, maintaining good health, and communicating openly with your partner, you can continue to enjoy a fulfilling sex life. Our fifth topic focuses on changes in ejaculation. As men age, they may notice changes in the volume and force of their ejaculations. This is largely due to natural changes in the prostate gland and a decrease in the production of seminal fluid. One phenomenon that some older men experience is dry orgasm, or dry ejaculation. This occurs when a man reaches orgasm, but little or no semen is expelled. It's often caused by retrograde ejaculation, where semen enters the bladder instead of exiting through the penis. While this condition is generally harmless, it can be concerning if you're not expecting it. Despite these changes, it's important to understand that orgasm and ejaculation are separate processes. Men can still experience pleasurable orgasms, even with reduced ejaculate or dry orgasms. However, if you're concerned about changes in your ejaculation, it's always best to consult with a healthcare provider to rule out any underlying health issues. There are several techniques you can try to improve the intensity of your orgasms as you age. Kegel exercises, which we mentioned earlier for pineal health, can also help strengthen the muscles involved in ejaculation. Regular practice of these exercises can lead to stronger, more satisfying orgasms. Another effective technique is edging, also known as orgasm control. This involves bringing yourself close to orgasm and then stopping or slowing down stimulation before starting again. This can lead to more intense orgasms when you finally allow yourself to climax. Exploring different types of stimulation can also enhance orgasmic pleasure. This might include experimenting with prostate stimulation, which some men find intensifies their orgasms. Always make sure to use appropriate hygiene and safety precautions when exploring new forms of sexual stimulation. Staying hydrated and maintaining a healthy diet can also positively impact the volume and quality of your ejaculate. Foods rich in zinc, such as oysters, pumpkin seeds, and beef, may help support prostate health and semen production. Now, let's move on to our sixth topic, the emotional impact of physical changes. It's crucial to understand that the physical changes we've discussed can have a significant emotional impact on men as they age. Many men tie their sense of masculinity and self-worth to their sexual performance, so experiencing changes in this area can lead to feelings of anxiety, depression, or loss of confidence. It's important to recognize that these feelings are common and valid. However, it's equally important not to let them overwhelm you or negatively impact your relationships and overall quality of life. Remember, sexual function is just one aspect of who you are as a person, and it doesn't define your worth or masculinity. One of the most effective ways to deal with these emotional challenges is to maintain open and honest communication with your partner. Many men feel embarrassed or ashamed to discuss sexual difficulties, but keeping these concerns to yourself can lead to misunderstandings and increased stress. Your partner may be experiencing their own age-related changes and concerns, and open dialogue can help you both navigate these changes together. It's also beneficial to adjust your expectations and reframe your thinking about sex and aging. Instead of viewing changes as losses, try to see them as opportunities to explore new aspects of intimacy and pleasure. This might involve focusing more on non-penetrative sexual activities, exploring sensual massage, or finding new erogenous zones. If you're struggling with feelings of anxiety or depression related to sexual changes, don't hesitate to seek professional help. A therapist or counselor, particularly one specializing in sex therapy, can provide valuable strategies for coping with these emotions and maintaining a positive self-image. Remember, self-esteem and sexual confidence are closely linked. Engaging in activities that boost your overall self-esteem can have a positive impact on your sexual confidence. This might include pursuing hobbies, maintaining social connections, or setting and achieving personal goals. Our seventh topic focuses on communication with your partner, which is crucial when navigating the changes that come with aging. As your body changes, your sexual needs and preferences may also evolve. It's essential to keep your partner informed about these changes and to be receptive to their needs as well. Start by creating a safe, non-judgmental space for these conversations. Choose a time when you're both relaxed and free from distractions. Be honest about what you're experiencing, both physically and emotionally. Use I statements to express your feelings without placing blame or making assumptions about your partner's thoughts or feelings. For example, instead of saying, "You don't seem to find me attractive anymore," you might say, "I've been feeling insecure about the changes in my body, and I'm worried about how they might affect our intimacy." This approach opens the door for your partner to share their perspective and feelings as well. Remember that your partner may also be experiencing age-related changes and concerns. Encourage them to share their experiences and listen with empathy. This mutual sharing can strengthen your bond and help you both feel supported and understood. It's also important to discuss any physical discomfort or limitations you may be experiencing. If certain positions have become uncomfortable, work together to find alternatives that are enjoyable for both of you. Be open to trying new things and adjusting your sexual routine to accommodate your changing needs. Don't be afraid to discuss your desires and fantasies with your partner. As you age, you may discover new turn-ons or interests. Sharing these with your partner can add excitement to your sex life and deepen your intimate connection. If you're finding it difficult to have these conversations on your own, consider seeking the help of a couples therapist or sex therapist. They can provide guidance and strategies for improving communication about sensitive topics. Our eighth topic explores new forms of intimacy. As we age, it's important to recognize that satisfying sexual experiences aren't limited to penetrative sex. Expanding your definition of sex and intimacy can lead to a more fulfilling and enjoyable sex life. Start by focusing on sensual touch. That doesn't necessarily lead to intercourse. This might include massage, gentle caressing, or simply holding each other. These activities can be deeply intimate and satisfying, helping to maintain your physical and emotional connection. Experiment with different forms of sexual stimulation. This might include oral sex, manual stimulation, or the use of sex toys. Many couples find that incorporating sex toys into their routine can add excitement and help overcome some age-related challenges. Don't underestimate the power of non-sexual physical affection. Holding hands, hugging, cuddling, and kissing are all important forms of intimacy that can help maintain your bond with your partner. Make an effort to incorporate these gestures of affection into your daily life. Explore activities that create emotional intimacy. This might include sharing your thoughts and feelings, discussing your hopes and dreams, or reminiscing about shared experiences. Emotional closeness can enhance physical intimacy and lead to more satisfying sexual experiences. Consider trying new activities together, both in and out of the bedroom. This might include taking a dance class, trying a new restaurant, or planning a weekend getaway. Shared experiences can create a sense of excitement and novelty that can translate into your intimate life. Remember, intimacy is about connection, not performance. By focusing on the emotional and sensual aspects of your relationship, you can maintain a satisfying and intimate connection with your partner regardless of physical changes. Our 9th topic highlights the importance of overall health for sexual well-being. It's crucial to understand that sexual health is closely tied to your general health. Many of the steps you take to maintain your overall health will also benefit your sexual function. Cardiovascular health is particularly important for sexual function. Regular exercise, especially aerobic activities like walking, swimming, or cycling, can improve blood flow throughout your body, including to your genitals. Aim for at least 150 minutes of moderate intensity exercise per week. A healthy diet is also crucial. Focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. Foods rich in antioxidants, such as berries and leafy greens, can help protect your blood vessels and promote good circulation. Omega-3 fatty acids, found in fish like salmon and sardines, can also support cardiovascular health. Maintain a healthy weight. Obesity can lead to various health problems that can affect sexual function, including diabetes and high blood pressure. If you're overweight, even modest weight loss can improve your sexual health. Pay attention to your sleep habits. Good quality sleep is essential for overall health and can have a significant impact on sexual function. Aim for 7 to 9 hours of sleep per night. If you're having trouble sleeping, consider talking to your healthcare provider about strategies to improve your sleep quality. Limit alcohol consumption and avoid smoking. Excessive alcohol use can interfere with sexual function, while smoking can damage blood vessels and reduce blood flow, potentially leading to erectile difficulties. If you smoke, quitting is one of the best things you can do for your overall and sexual health. Manage chronic conditions effectively. Conditions like diabetes, high blood pressure, and high cholesterol can all impact sexual function. Work with your healthcare provider to keep these conditions under control through medication, diet, and lifestyle changes as needed. Don't neglect your mental health. Stress, anxiety, and depression can all have a significant impact on sexual desire and function. If you're struggling with mental health issues, seek professional help. Therapy, medication, or a combination of both can be effective in managing these conditions and improving your overall quality of life, including your sex life. Regular checkups with your healthcare provider are crucial. Many sexual health issues can be early indicators of other health problems. By addressing these issues promptly, you can often prevent them from becoming more serious. Consider getting your hormone levels checked, particularly your testosterone levels. While a decline in testosterone is normal with age, significant drops can affect libido and sexual function. If your levels are low, your doctor may recommend treatments to bring them back to a normal range. Our 10th and final topic focuses on accepting the aging process and developing new perspectives on sexuality. It's important to remember that aging is a natural and inevitable process. While it brings changes, it also offers opportunities for growth, wisdom, and new experiences. One of the keys to maintaining a satisfying sex life as you age is to adjust your expectations. Understand that your body may not respond the same way it did when you were younger, and that's okay. Instead of comparing your current sexual experiences to those of your youth, focus on the present and the unique pleasures and intimacy you can experience now. Embrace the idea that sex can actually improve with age. Many older adults report that they enjoy sex more in their later years. This can be due to increased self-confidence, better communication with partners, and a deeper understanding of their own bodies and desires. Consider redefining what sex means to you. As we've discussed, intimacy and sexual satisfaction don't have to be limited to penetrative sex. By broadening your definition of sex and intimacy, you can open yourself up to a wide range of pleasurable experiences. Take advantage of the increased free time that often comes with retirement or reduced work responsibilities. Use this time to focus on your relationship, explore new interests together, and prioritize intimacy and connection with your partner. Remember that sexuality is a lifelong journey of discovery. Stay curious and open-minded. You may discover new sources of pleasure or new ways of connecting with your partner that you hadn't considered before. If you're single, don't assume that your sex life is over. Many older adults find new partners later in life. Online dating has made it easier than ever for older adults to connect with potential partners. Just remember to practice safe sex, as sexually transmitted infections can affect people of all ages. Cultivate self-acceptance and body positivity. Your body has carried you through life and deserves respect and appreciation. Focus on what your body can do rather than how it looks. Engage in activities that make you feel good in your body, whether that's dancing, yoga, or simply taking a relaxing bath. Finally, maintain a sense of humor about the changes you're experiencing. Being able to laugh at yourself and with your partner can help alleviate anxiety and keep things in perspective. In conclusion, while aging does bring changes to your sexual health and function, it doesn't mean the end of your sex life. By staying informed, maintaining open communication with your partner, prioritizing your overall health, and remaining open to new experiences, you can continue to enjoy a fulfilling and satisfying sex life well into your later years. Remember, every individual's experience of aging and sexuality is unique. What's most important is finding what works for you and your partner. Don't hesitate to seek help from healthcare professionals or therapists if you're struggling with any aspects of your sexual health. Thank you for joining me for this comprehensive discussion on men's sexual health and aging. I hope you found this information helpful and empowering. Remember, your sexual health is an important part of your overall well-being at any age. Take care of yourself, stay open to new experiences, and continue to prioritize intimacy and connection in your life. If you found this video informative, please don't forget to like, comment, and subscribe to our channel for more health-related content. Your engagement helps us reach more people with this important information. And remember, if you have any concerns about your sexual health, always consult with a healthcare professional. Here's to your health and happiness at every stage of life.